Hello, everybody. Welcome to our first in-person Board of Health, I think in over a year, at least, right? So welcome. Okay, we have a number of things to address this morning, particularly before we have some clinicians who will have to depart. So I'm going to kind of move us through this agenda to make sure we can vote on things that require our quorum. So I'm going ahead and calling us to order. I don't believe we have anybody for privilege of the floor. Is that correct, Frank?
Correct.
Okay, so I'm going to go ahead and move us to approving the August 23rd minutes. I'll give folks a second. Those are in your packet to pull up. I'll need a motion to approve this written, a first from Melissa and a second from Shauna. Any discussion? Okay, all in favor as written. That's unanimous. So we'll go ahead and move on. We'll focus. Do we have someone to do the financial summary?
We don't. Brenda
Okay.
is out, but there's a report in your packet.
Okay.
Much there.
And you don't have anything to add, Frank?
I do not.
Okay, are you ready to go ahead and do an administrative report then?
Yes, I am.
Okay.
All right. So thank you, everyone. Welcome back to our first in-person meeting. Quite some time. We'll get the table tents and all that stuff worked out. We're just getting our feet back under us. We're trying the new technology. It's the first time we broadcast from this room, so see how it goes. And hopefully it goes well. And we'll be meeting here kind of moving forward. Just a reminder, the county policy does allow for remote participation, but you are not then eligible for quorum. So we do need to have as many folks in person as possible so we can maintain our quorum, which we have today. So thank you. As far as updates, there's quite a bit going on. Just going to touch on some key areas. Starting with COVID, things are stable. Our case numbers were high as the students returned, both higher ed and then K through 12. So there's definitely still cases. It's higher than we would want, but I think we've kind of plateaued for a bit, at least for the last week or so. Our hospitalizations have remained low throughout, which is a good sign and the key measure we're following. At this point, we continue to put out public information related to COVID, including around the bivalent booster, which is now available for anyone 12 and up. That has at least 2 months out from their previous vaccine. We are relying on the local pharmacies and healthcare system to provide those vaccines. We do recognize that appointments are a bit difficult to come by still, but we're hoping that that's going to start to loosen up. The counties around us have plenty of appointments. So it's really kind of reflective of what we've seen throughout, that our demand here is a bit higher than other places. So we do expect that those appointments will start to become more available. So we're keeping our eye on that. On the monkeypox front, we have not had any new cases recently. And our staff has been working diligently to put together a monkeypox pods for the vaccine. So we've had 2 so far, very successful. I think one was just over 70 doses and the other was just over 60. So we did have some interest. We're now planning for the second dose clinics, which will start next week. And we're working with our higher ed partners to get them some vaccines so they can begin administering on campus. So that's where we are on the monkeypox front. A couple of things that are in the news and that I've been involved in. The first is the encampments. The homeless encampments have been participating at the county administrator's request with the TIDES group, which is a group that was looking at a sanctioned encampment model. So that process is kind of working its way through the legislature and Common Council for their review and input. And feedback. I don't know where that's going to land. What I can say is there are significant issues in the encampment and they are growing. And so, from my perspective, we really need to have some sort of action, and we're looking forward to getting some guidance and direction from our county council and legislature on what they want that direction to be. What else? There was one other thing and it just slipped my mind. Okay, well, I'm going to stop there and I'm happy to answer any questions.
Any questions for Frank? Administrative report. Okay, let's go ahead and move on to health promotion, except that we don't have anyone from health promotion, I don't think. Do we know so I don't see Sam or Ted, who would usually. Okay, so nobody from health promotion?
No,
That's fine.
but what we did want to mention to you all is work on the community health assessment and community health improvement plan is going on.
Mhm.
And we're making some progress on that. We're shooting for your November, December meeting to bring that to you for your review. Essentially, it'll be close to a final product at that point, but just wanted you to be prepared. I do believe in the October meeting, they're hoping to have some of the data and information in your packet, more thorough than I think is in there for this month. So you have a chance to review, what they're looking at. The process has been good this year. A lot of participation, a lot of coordination with mental health. So we're excited about that. And just to kind of add, the local services plan, which is currently an annual plan that's required by mental health, substance abuse, substance use disorders, and mental disabilities at the state of the mental health department is being worked on as well. Harmony's leading that. Starting next year, instead of being an annual plan, I think it's going to move to a 3 or 4 year plan, which makes more sense, which we're also hoping will allow us to more easily align it with the community health improvement plan. Because as we have in the past, and we're expecting moving forward, mental health and substance use disorders will be a priority area of the community health improvement plan. So what we're hoping is that the local services plan will be the plan that falls under mental health and substance use disorders in our CHIP, as it should, because that's coming from the subject matter experts and others in the community. So we're excited about that change and are looking forward to both of those being more integrated moving forward.
Okay, great. Any questions on that from folks? And then I guess the same question about Dr. Claypack, who's not here.
Yeah, Dr. Claypack is away.
Okay. So is there anything in addition to the report that he included
I don't
or sent out for those of you who get the practitioner's bulletin? Okay.
You try to answer the question.
So Claire.
Okay. I think Frank describes the state of communicable disease clinics pretty well. Rachel, who should be back if there are specific questions for her. I'd say it's a remarkable month in that we were kind of tracking 3 different portfolio. So same time also getting our back to school program immunization clinics running and meeting that need and I think working through lots of challenges with our so other than that, the visions. So we're really excited to be onboarding 2 new community health workers, and we've just finalized the recruitment for the supervisor. Will begin in October. So we'll have more to report next month. Program is really going to allow the community health worker program to support parents and expecting parents in Tompkins County and their families to connect with resources that they need. And that's mainly what I to mention. I guess in terms of staffing, so we're still in recruitment for communicable disease nurse. for sharing that announcement with your network. Rachel Freed, so she's in orientation now, and this position is now open for recruitment. I mean, it's a difficult decision to step down of November, so my last day will be 8, and that was for all reasons. So. Working with Collins.
Yeah. Goodness. Thank you for everything you did for the community the last couple of years. So, yeah, we know it's been tough, so we appreciate it. Sorry. Can you talk just a little bit about the community health director position and the qualifications for that, since we have anybody who might be able to share?
So Frank Butt is the head of the recruitment committee.
Oh, okay.
In any way. I will pull up the position description.
Do you need a nursing degree? Do you need MPH? Like what?
So I don't have a nursing degree, and I was the first non-nurse to fill that position. Okay. So I think there's a combination of graduate degree, probably only master's in public health, but it may also be open to other fields.
Okay, that's fine.
And then experience.
Okay.
Yeah.
So for those of us maybe who work in those networks, if we know of anybody that might fit, we'll send it to the head of the recruitment.
Yeah. It's a big help.
Please do.
That's okay.
Good things about the team.
And Claire has done a great job. As she said, she was our first non-nurse to fill the position. And I think we learned some things from that, both, good and things we need to address if we go in that route forward. But the job description does recruit for different titles. We would accept a nurse. I think we prefer a nurse in the position, but there are also other MPHs. I believe MPA is also allowed.
Okay.
It's in the job description, but we need at least, I think, 4 or 5 years of experience for that position in some sort of leadership / management type title to lead the division.
Okay, great. Thank you.
Full-time position.
Yes, very full-time.
And I have nobody to offer you.
Okay, thank you. Okay, any questions for Claire? Yeah, Shauna.
I was just wondering, and I don't know where this even fits in. Is there any way that we could have some type of reporting, whether it be on a monthly basis or a quarterly basis, on the overdoses that are happening in the county?
Yes, yeah, we can absolutely do that. We post the information to our website already, so we can have it included in the packet. I will make sure that our health folks get that added for you.
Anything else? I also don't see children with special health care needs.
Yeah, Debbie is out.
Okay, so we'll go ahead and move on to county attorney. Anything from our county attorney?
No, we have a couple of matters in train here, but nothing really to report.
Okay, great. Thank you.
My pleasure.
And we also do not have our environmental health staff here.
Yeah, I'm trying to work on that. Apparently there's some issue with the link.
Okay.
Is Dr. Beck is trying to get in? If you
Oh, there is people in the waiting room now.
Oh, son of.
If you look at the top.
Yeah, that's my fault. Thanks. There they all are.
Oh.
Sorry. Sorry, everyone. Sorry. You were in the waiting room and I didn't realize it. So welcome, Christy, Dr. K, and Ted.
We were wondering where everybody was. So let me just go back to health promotion. Ted, did you have anything that you wanted to add? There's another.
Hi,
Hi.
everyone. Sorry.
Um,
Waiting room and I didn't realize it.
yeah, I
Waiting room.
Oh, it's Zoe.
thought I was being,
We were wondering where everybody was.
all right.
So let me just go back to health promotion. Ted, did you have anything that you wanted
One
to?
second. I know what's going on.
Is it recording?
No, it's my fault.
Hold
Waiting room and I didn't realize it.
Yeah, I thought,
Waiting room.
Oh, it's Zoe.
okay. All right, I'm here. My YouTube is off. And thank you. Thanks, Frank. Yes, the only other, I think, I was texting with Sam, who's at home. He's not available. And asking her how to get in. And anyway, she said that Frank had given an update on the CHA, which is probably about what we would have given.
Okay.
Other than to add that in the next meeting, the November, December meeting, we plan to give a presentation for the CHA and the survey. So we're doing analysis with the survey now and getting some really good insight. So that was a valuable exercise. The only other thing to add is that we have hired a new health educator. And I'm seeing if I can find, her name is Ambra. Her name is Ambra Munlin. And she seems great. She has been working at Planned Parenthood. She's got an MPH from Buffalo, had a lot of experience at Planned Parenthood, working with clients. She also worked at CMC in the CHOA, the cancer, hematology, oncology group for a while. So she's got a lot of front-facing experience, which is great. Her tasks will be half for the Healthy Neighborhoods program and half for the tobacco program. Yay. So we'll get back on track with the tobacco program, pick up where we left off. That's been going on in Cortland and robustly. And so she'll be able to slide right in to what Cortland County and Shenango County have been doing all along. And I think she'll do a fabulous job. So that's about it for what we have.
Great, thanks, Ted. Any follow-up for Ted? I think we're looking forward to your presentation next month, so.
Yeah, we're looking forward to it too. We're quite excited about it all.
Thanks. Dr. Claypack, let me come back to you. Did you want the floor for a little bit?
Okay.
I'd be glad to take any questions. I don't really have anything that's changed since I wrote that report about a week ago. Between now and then.
Additional questions on top of the overdose death? Okay. I think we're good. Thank you. Environmental health.
Christy's filling in for Skip and
okay.
Liz. They're at a conference.
Yeah.
Christy.
Hi. The only update I have that Liz asked me to give from the report was that they had an office conference last week with grassroots that went well, and we're not sure at this point if they'll be signing the office conference or signing the stipulation agreement or doing an administrative hearing. But we should be finding out in about a week or so. And that they have hired Witham Landscape Planning Design Landscape Architects to provide permitting services for the mass gathering. And they had a representative from that group at the meeting, which is hopefully promising.
Okay, and so is this to address next year or this is to address this past year?
This is for the current enforcement that is in process.
Okay,
Yeah, so I was part of that meeting as well, and it was to address the current enforcement, but to set up a plan so next year is not
Yeah.
like this year.
okay.
And we are encouraged by the hiring of the architecture firm. They are active and interested in making this more clear and more effective for both us and them. And we've created a timeline that we think will get things in significantly sooner, which will allow for the design to be accurate. And then we're also requiring that the architecture firm sign off that the plan has been implemented and put in place as it was designed at that pre-operation inspection that we do 5 days beforehand. So it won't simply be relying on us to tell them what is or isn't. They're going to have a licensed professional doing that ahead of time. So our goal is to really make this about them building a plan, a good solid plan, and then implementing that plan, having their licensed professional say, yes, we've implemented the plan as I designed it. And then all we're going to have to do is just go and confirm that. So if everything goes well, it should be a much different process than it has been in the past. And I think to their credit, Grassroots came in very receptive to our significant concerns. And they don't want a repeat of what happened last year either. So we are working with them. I will tell you, we have proposed a fine for them, which is significant, but we offered to reduce that fine and allow them to earn credit towards it if they meet the timeframes that we set. So it would significantly reduce that overall fine to them if they're able to achieve these timeframes that have been laid out. So we're trying to be very supportive. We're hoping that they'll reinvest that fine money into their architect and doing the things that need to be done. We're not interested in taking money from Grassroots. We really just want compliance. So we've tried to be very, very open to making this work with the organization. I think we're in a good place. Their first meeting with the new architecture firm is this Friday. So we're already in the processes of planning.
Questions? Comments? Okay, so I think we're left with the CSB report. So Harmony, are you able to, have you met?
Yes, Community Services Board met on, sorry, I didn't remember the day we just met, September 12th. And as Frank talked about, we did look at our local services plan that we should have completed by our next meeting on October 3rd. We also had a guest speaker, Denise Freeland from Mosaic Challenge, and she talked to the board about their work in creating an Article 16 clinic in our community. This is a really important service that will be added. It will provide mental health services for people who are in the OPWDD, or Office of People with Developmental Disabilities system, that they can get specialized mental health treatment in our community. So excited to have that happen as well. And they did some work on looking at the bylaws and the charter to finalize that piece.
Any questions for Harmony? Thanks, Harmony. Did you all have any discussion on the bylaws?
Yes, we had discussion on the bylaws as well.
And is there anything to note from that, or?
I'm imagining, Frank, you can add more to it. My recollection was they felt pretty comfortable with where they were at and the updates that had been done.
Okay,
Yes.
I just want to make sure there wasn't anything we had to, okay. All right, thank you, Harmony. All right, anything else in terms of administrative updates from Health Department staff or questions for Health Department staff or board members? Right, so let's go ahead and move on to our new business, which will be, we've got 2 enforcement actions to discuss. So let's go ahead and start with our first resolution, which is related to the Tibetan Momo Bar. So, and I think these are both, if I remember correctly, hot holding. We food service, temperature violations for both of these organizations. So let's go ahead and start with the first one. So we'll need a motion to approve as written. We have a first from Sue. Second from Melissa. Okay, any discussion on this, or Christy, anything that we need to know in addition to what's already in here?
There's nothing additional to what's in there. We haven't
Okay.
had any further communication with them since that.
Okay, and I would just draw to the board's attention that it looks like Skip made a few edits on this too, on the second page that are initialed in handwriting. Okay. All right, so all in favor is written. We're unanimous. So let's move to the second, which is for the Strand Cafe. And I believe, and Karen, just correct me if I'm wrong, they sent us email communication as well, correct? Is it in there? Okay, the last. So that's in there, which wasn't, they just wanted to explain that they understood and were addressing it. So I'll need first a motion to approve as written from a board member. Okay, first from Ed, a second from Samara. Open for discussion. Christy, is there anything in addition on this one?
No.
Okay. Any comments? Yes, Sue.
So I'm assuming the higher fee is because there's regulations?
The higher fee on this one. So with the Tibetan Momo bar, there was an item that was in hot holding. And whereas in this case, it was equipment, not being operated or maintained correctly. So there were multiple items over a longer period of time, which we gave a higher fee because it's a greater public health hazard.
It seems like it's a choose.
Yeah, they had stock soap and paper towel violations as in addition to the hot holding. Sue, did you have any more?
No, I
Okay.
make sure I was on the right page.
Yep. Any other questions or comments on this? Okay, all in favor is written. I think that's unanimous. So let's go ahead and move on. So our next items for discussion are administrative actions. So one is a discussion about term limits. And Frank, did you send that out to everybody or just to me?
No, I didn't. It's still, so the bylaw is just kind of an update on things. The charter and the two bylaws from the Board of Health and the Community Services Board went to Health and Human Services last month for their feedback because we wanted them to have an opportunity to give feedback before the process. There really wasn't any. They were good with things. However, in the interim, the legislature is now looking at a new policy related to advisory boards that could create term limits and or the length of time of of serving. So they're still in that process. It's not finalized yet. What I have suggested to Christina and Mary, the chair of Community Services Board, is that we hold sending in the bylaw updates until we get this new policy from the legislature. And once we get that policy, then we can react to it and make any additional adjustments that might be necessary to the bylaws. The big thing is term limits. Board of Health already has term limits. The Community Services Board does not. So the impact is larger to them. There is some conversation going on, I believe, about the length of terms as well. And so Board of Health terms are 6 years. Other terms have been traditionally 4 years. So there's some conversation about that, but none of it's finalized yet. So we're really not in a place to respond or react other than if you have significant concerns about term limits and or length of term, we should let the legislature know that so they could consider it.
And just to clarify, so this new proposal that they're thinking about would require term limits, so they're in favor of them?
It could. It's not finalized yet. So the version that I originally saw said May, but my understanding is that the legislature is considering stronger language that would require term limits. So we just need to let it go through that process and see what comes out of it.
And what's the timing on that?
Likely close to the end of the year.
I think what we're also trying to do is make it consistent through all of our advisory boards so that we don't have one board that has no term limits, one board that has 2 term limits of 4 years each. That way it'll be easier for our clerks to track it, because right now it's all over the place and we're just not able to track it. And I think the sense on the legislature from many of the people that I've spoken with is that term limits are good. It's nice to have fresh ideas, new people. And sometimes whenever you have people that have been on the boards for a while, the conversation becomes stagnant, the ideas become stagnant. And, also there's a sense that some of the boards aren't welcoming to new people. So we want to open that up and make sure that our community feels welcome.
So Frank, can you remind me so the term limits is one piece of it, but the length of the term is the other piece. And so the Board of Health length of term at 6 years, is that something that is defined by our county in the charter, or that's something defined at the state level?
I believe it's defined by the county. I
Okay.
don't think length of term is in public health law. I will
Okay.
go double check that.
Okay,
I think public health law just determines who needs the type of people that need to
Okay.
be on the board. It doesn't talk about limits or length of term, but I'll double check.
okay. And so then if the decision is to go to the 4 years, that would impact Board of Health as well. We would
It
shift to
would.
Board of Health.
Yeah, and my understanding is the thinking of the legislature, and Shauna, correct me if I'm wrong, is that whenever that policy goes into effect, people would be able to finish out the term that they're in.
Yeah.
Under, whatever they were appointed under. And then when
Next
their
one.
existing term ends, all those rules would come into effect once their term ended.
Okay,
I think ideally too, you would have some staggering so that it's not like all of us are off the board in 4 years and you start out with like 10 new people. That would
Yes.
be an absolute disaster.
You didn't
So-
grandfather us in, we'd all be gone.
Yes.
And that already exists for both boards. So for the Board of Health, part of the reasoning behind 6 years is technically 6 of you are appointed by the legislature. Sean, as the legislative rep, there's really no appointment. The legislature does that. And then the city appointment is the other one. So I'm not even sure who's filling the city seat right now, but
I think
So-
it's Ravinder, isn't it?
it might be Ravinder,
Yeah.
yeah. So the 6 other seats rotate, I think, on one every year. So we already have that. Same with the Community Services Board. There's so many people. There's 15 members of that board. So there's a few people each year that kind of cycle up, but they currently only have 4-year terms.
Okay,
And our term limit is 3.
Well, technically, your term limit is 2 plus any unfinished term that you completed. And I believe the legislature proposal accounts for that as well. That as long as you don't get appointed, I think in the first 90 days of a term, you could technically then have 2 full terms after that one you're completing. So I guess you could end up being 11 3/4 years if you
Mhm.
timed it perfectly. As the max.
Yeah.
But again, this is all still in draft phase, so it could change through their discussions and consideration.
okay. Thoughts on that?
So I don't really think there's anything for you to do right now. If you have significant interest in this, certainly let Shauna know or any of the legislators so it can be considered. We are going to move forward with the charter on the same path. So we were going to do all 3 together, but we're going to hold the bylaws. The charter, county attorney's office is in the process of drafting a local law and a resolution to go forward with the draft charter, which will go to government operations, which I think is October 6th, and then HHS, which is October 17th. Then it goes to the full legislature. They have to have a public hearing. And then they have a subsequent vote for that. So likely that won't be complete till the 2nd meeting in November of the legislature, but that will move forward ahead of the bylaws.
Okay, so the second thing that's in here is the community health quality advisory. It's a mouthful. The Community Health Quality Advisory Committee. So I actually just sent everybody an email at the beginning of the meeting with the list of names. And Karen, I sent it to you too, so that you can include it into the packet. So Claire, we introduced this at the last meeting, which is that one of the things that fell by the wayside during COVID was that we technically have to vote and approve the members of this committee. So what I sent to everybody were the list of names of the new people that we'll be voting on, which are in red. Is there? Yeah.
One person is already in them.
Okay, which one are we taking? Okay, Brenda's. Okay. So we are voting on 1, 2, 3, 4, 5, 6 individuals, correct?
Yep.
And so I'll just name those individuals. Christina Van, representing Cuga Medical, Lindsay Ward, also representing Cuga Medical, Melinda Reese, representing the Child Development Council, Karen Bishop, representing as a community member, Serena Ward as a community member, and Sam Stevenson or Justine Waldman from Reach Medical. And then we have 3 more community members that at some point will be coming forward, right? Okay, so we'll come back to those. So what we're voting on today are the names that I just read that are in red for folks. So if I could.
Before you do that, if anyone wants to talk about any particular name listed there, we would need to go into an executive session to have that conversation. So you should ask if anyone wants that before you move to vote.
Would anyone like to have a discussion about any particular name on the list? Okay, so we will decline the offer for executive session. Thank you. And can I just do a straight up and down vote, or do I need a motion, or?
You could just ask.
To approve let's, if we can move to approve everyone's name that I just read, all in favor? And we are unanimous.
I'm sorry, I guess I don't know these people, so we don't know what we're voting for. Sure.
Okay, so.
Do you want me to back up?
No, I don't know. That's just,
Do you want Claire?
Is that important to know?
Well, do you want Claire to talk a little bit more again about the committee?
Yeah.
That's fine. Yeah, that's okay. It was last meeting, so it's been a month. So Claire, could you just refresh everyone's memories? It's okay.
The Community Health Services Quality Improvement Committee. It's basically the services that we provide under the LICSA and the DNTC, the Diagnostic and Treatment. Hire this to the committee to review recommendations or encouragement initiatives that we're taking to improve the quality. So they meet quarterly, and these members that we've proposed are primarily replacing their predecessors from 2022 for June. And then we've proposed is an additional Stevenson or Justine Waldman is into that, and we have an additional community member and are proposing a third community. So those most of the people that you're approving are replacing their predecessors.
I appreciate that.
Based on their technical expertise and
And then this committee is actually in our bylaws as well, which is how we came back around to realizing, because we were looking at the bylaws and so it raised the question of where are we on this? Yeah.
Recap.
Yes, that's the recap. Okay, so let me ask again, are any of these names that someone would like to discuss in executive session? Okay, so all in favor?
Can you get a motion to accept the list?
Sure. Can I have a motion to accept the list as written? I have a first from Sue and a second from Shauna. Any additional discussion needed on these? Okay, all in favor as named? And that's unanimous. Okay, do we have any other items? I think that's our full agenda. Hold on, I just lost my agenda, so I think that's our full agenda. So if we have nothing else, we've accomplished what we set out to. Have a great rest of your month. We'll see everybody next month.
We have the November, December combined meeting.
I think that's,
September, never mind.
we're only in
That'll be in
September.
October.
Yeah. Thanks.